I would like to talk about disc herniation in the upper back, that is thoracic spine. Its latest treatments available today and how it is dangerous. So, thoracic disc herniation is a herniated disc which is in the upper back, which is a cushioned disc in your upper back which bulges out and presses on the nearby nerves. This can cause mid-back pain that can wrap around your chest area and even tingling or weakness in the lower limbs if spinal cord is severely pressurized. Many thoracic disc herniations don't require surgery and improve with rest or therapy. But if a disc causes severe symptoms and it isn't improving with other treatments, surgery might be needed. Good news is that now we can fix it with a minimally invasive endoscopic procedure using a tiny camera through a very small incision 7 to 8 mm, which means less impact on your body than open surgery. What is the difference between thoracic disc prolapse and lumbar disc prolapse? Thoracic disc prolapse, here the disc comes out in the thoracic disc which is surrounded by the rib cage, and the spine which is there is more stiff compared to lumbar spine because of the thoracic cage. And here most of the time discs are very hard, firm, and the canal for the nerves is very narrow when compared to lumbar spine. So when a patient has a thoracic disc prolapse, patient have tremendous symptoms in the form of pain, sometimes weakness in the lower limbs, tingling sensation, bowel and bladder control goes away faster when compared to lumbar disc prolapse. That is why thoracic disc problems should not be neglected when you have, and reach doctor immediately when you have a thoracic disc problem. So what is this endoscopic spine surgery? This endoscopic spine surgery is a modern minimally invasive technique to fix spine problems using a tiny small incision instead of large cut needed in traditional surgery. We insert a thin tube a width of a pencil through a tiny opening, and a camera on the end that is called endoscope lets the surgeon see a magnified view inside, and we use a special instruments through the tube to do the repair. For example, in a thoracic disc case, the surgeon can remove the herniated disc material through this small tube. Because we aren't cutting muscle or bone extensively, there is much less damage to surrounding tissue compared to open surgery. How the surgery is done for an endoscopic thoracic spine surgery? You will be under anesthesia, not awake. The surgeon makes a tiny incision on your back near the affected disc. Through this, narrow tube is placed to reach the spine. A small camera, that is endoscope, goes in, giving a clear view of the disc and nerves on a screen. Using the view, the surgeon passes tiny instrument through this tube to carefully remove the bulging disc or the damaged part of the disc. Once the disc is removed and the pressure is relieved, the instruments and camera are taken out and little incision is closed with just one stitch or sometimes no stitch.